going to first start with apologies. I have way too many slides for the amount of time, but I'm going to try to go through them both efficiently, but also to really get on to some of the things that you might like to hear about. So what I want to start with is to talk about what ADHD is and kind of what the criteria is so that we kind of have a background, and then I'll begin to move into some of the things that we think might be helpful for children with ADHD. So the diagnostic criteria for ADHD is that it's significant and age-inappropriate symptoms of inattention or hyperactivity, impulsivity, or restlessness. The onset is prior to the age of 12. It needs to have lasted for 6 months or longer. Kids need to have difficulties in 2 or more settings, that is like home, school, athletic activities, and it needs to cover, difficulties that are both social, academic, or occupational or work. And most importantly, that the symptoms are not better accounted for by another psychiatric or mental condition. And adults can have fewer symptoms to meet criteria. There were a few changes from the old, what we think of as DSM-4, which was the diagnostic manual that helps us to understand the criteria for different psychiatric disorders. And it's not so important to go through all of this, except to understand the biggest differences are that ADHD moved from a section that was known as disruptive behavior disorders, or what I used to call naughty boy syndrome, to neurodevelopmental disorders. So we really have a much more sophisticated understanding that's been supported by research that ADHD is a brain condition. The age of onset was raised to 12 from 7, but what's really important now is that both ADHD and autism spectrum disorder, ASD, can be diagnosed as co-occurring conditions. In terms of how much does ADHD actually occur, part of that depends upon who you ask. If you're talking to parents only, the statistics from the Center for Disease Control in Atlanta is that it's somewhere around 11 to 23%, which sounds a little high, but when you actually look at both parent and teacher data together, it's somewhere in the 5% category. So really 3 to 5%, or 3 to 7% of the childhood population, and about 4% for adults. It's more commonly diagnosed in males than females in pediatric populations, that is in young children, but as we get into adolescence and adulthood, it's really about 50-50 for both, for adults. In terms of the core symptom areas, we think of attention, inattention, and then impulsivity, hyperactivity, and restlessness. And back in the dark ages when I went to graduate school, we were taught, well, ADHD is a childhood disorder. Kids outgrow this isn't gonna go on, so you don't really need to worry about it a whole lot. But in fact, what research has helped us to understand is that there are many components to the symptoms, and that there are some components that as kids get older and reach towards puberty, that there are some symptoms that do begin to decrease or drop out. That is, we see less hyperactivity as kids move from early childhood, towards adolescence, and perhaps less impulsivity or restlessness. But one of the core symptoms that does tend to remain throughout the condition is the inattention. So in adolescence, we might not have super wiggly kids who are running around the classroom, but these are kids who are still kind of running around in their head. They are having difficulty paying attention, staying on task. Now, there are lots of diagnostic and treatment challenges to ADHD, and part of it is something that we call the heterogeneity of presentation, which basically is a way to say ADHD is manifested in a number of different ways, which is why it can be confusing, because some kids might have lots of hyperactive symptoms and not really very many others. Some kids have lots of symptoms of inattention, distractibility, very disorganized, but not hyperactive at all. And so things like that sometimes make diagnosis kind of difficult or complicated. And ADHD is one of those conditions that can co-occur with many other conditions. The most common ones are anxiety and depression or learning challenges in school. However, it can also occur with autism spectrum disorder. So sometimes there's kind of what we think of as this mismatch between what our treatment options are and what the symptoms of the condition are. And another piece, which is why this is called a neurodevelopmental condition, is that there's a developmental progression. All the symptoms don't occur all the time. The symptoms occur and change in prominence over time. So for example, it's a little hard to see the slide, but at the very beginning, for preschool kids, what we're mostly seeing is the hyperactivity, the wiggliness. These are the kids, they go to preschool and they're having trouble just, sitting in the circle at circle time. When we get to school age kids, we sometimes still see the hyperactivity, the wiggliness, but because the academics of school begin to kick in, these are kids who might be struggling not because they're not bright, but because the inattention is making it hard for them to pay attention, to read, social cues. And then as we move into adolescence, we can see the same symptoms, but what gets added to that is that in adolescence, that's frequently a time where other kind of risk factors or other things that teens might be exposed to begin to occur, such as that there might be pressure to try cigarettes, there might be pressure to try, alcohol, there might be pressure to, try drugs. So it begins to complicate the diagnostic picture. Same thing with college-age students. They could have the inattention, the distractibility, but they're also trying to manage largely independently academic work, with all the kind of social pressures that might go on with being, in a college setting. And then, for adults, which we will not spend a lot of time talking about this evening, is that you can have a lot of the same symptoms that occur in adulthood, but what gets added to that is because adults are often out working in the world, there are implications in terms of how people are doing, in terms of job functioning, in terms of relationships or marriages, in terms of, just things like being able to, drive well. So here at the Mind and at other places, there's a way to assess for ADHD. And unlike things like, diabetes or high cholesterol, there's no test for ADHD. However, we do it through, kind of careful, what we think of as clinical or diagnostic work. That is, we do clinical interviews, with the children or teens or even young adults. We make observations, we interview parents or other important adults in the person's life. We use ADHD rating scales. We get information from many different collaborators, and we might even look at previous records like school records, other assessment or diagnostic evaluations. In terms of treatment, we know that what we call pharmacotherapy or medication is effective at treating what we call the core symptoms of ADHD. And the core symptoms are things like inattention, distractibility, hyperactivity. And incidentally, California just happens to actually have some of the lowest rates of stimulant prescribing in the nation. And in addition to perhaps something like medication, for young kids, we might employ things like parent education and behaviorally focused family work. And the Mind Institute does run 3 to 4 parent education groups a year for the parents of children who are between the ages of 4 and 11. And then as we think about teens and adults, it's often pieces like coaching or organizational skill development or more help with, complex academic work. So want to get in now a little bit about some of the things for classroom management, and you'll hear one of my other co-presenters, TJ Vidales, talk from a teacher perspective. And one of the things that I did in the past prior to coming to the Mind Institute is that I actually was a consultant at a school specifically for kids who had dyslexia, many of whom also had co-occurring ADHD. And so many of the things that I talk about here are things that we actually implemented in that school setting. And so we talk about things like using the first 6 weeks of school to establish kind of behavioral control and kind of set the standards and the norms. There are established programs out there that can help teachers to do that. The particular school where I consulted, we used something called responsive classroom. Things like developing a token economy. And a token economy is merely a way of saying, things like, oh, when you turn in your homework, then this activity will occur next. And it helps to set up a structured environment in which kids know what to expect within their classroom setting. So things like developing and posting clearly defined rules and responsibility. And for some kids, it means perhaps decreasing total workload if that's possible and if that makes sense. And often going for things like quality over quantity of work and sort of targeting productivity. Because when we actually look at some of the research in terms of how kids with ADHD are doing in school, where they're having difficulty is with productivity. It's not necessarily with accuracy, it's with the amount of completion of work. So things like giving weekly assignments. So at the school where I consulted, in the beginning of the year, we had an entire kind of training program to basically teach kids both how to do work inside the classroom, but also, more importantly, how to do things like homework at home. So teachers gave weekly assignments so that parents could plan the week accordingly, and that information was emailed home. Sometimes actually within the classroom, you might think about things like optimal desk arrangement. Some kids need to be close to the teacher so that they can have kind of eye-to-eye contact. And other kids might need to be in the back where they can stand or move without distracting others. So there's no particular right or wrong way to manage that. It's what might be most helpful for that particular child. Also allowing some restlessness in a work area and having children in a work area where they can do that without disrupting those around them. And really importantly is giving frequent, physical exercise breaks so that kids are not sitting for extended periods of time. It's also important to focus on specific behaviors rather than ADHD in general. That is, if the difficulty is work completion, it's trying to figure out how do we help the child to be more productive. We want to help children to engage in behaviors that are incompatible with challenging behaviors. Some teachers have done things like teach young children how to knit, because if you're allowed to knit while you're listening to instruction in class, it's much harder to poke your neighbor. You want to do things like assessing, what are the things that come before a problem behavior occurs so that you can figure out how might I address that? Because once you have a problem, it's much harder to address. So it's like, can we go back a few steps and think about what may have helped beforehand or what may have led to this particular thing? I talked about token economies before, and just importantly, these are things that are helpful for all kids in a classroom, because when kids who don't have ADHD are kind of managed well, that certainly frees up teachers to be able to provide better focused intervention to kids who might need it more. You're trying to set students up for success, so you're maintaining structure and having high levels of supervision. You make sure that children know what the structure is and what the expectations are, and you're really concrete and make sure that your instructions are multi-sensory whenever it's possible. That is, you have lists, you have pictures, you have things that make it clear what your intentions are and what you're asking for. And because kids with ADHD, sometimes have trouble interacting with their peers, as much as possible, embedding learning, with social skills like actually in the classroom setting and in activities that you're doing. Developing organizational systems that use binders or folders, particularly helpful as kids are getting in that late elementary school, kind of middle school range. Using programs where kids can practice particular academic or management skills on computers. Things like assigning homework buddies. It says home buddies, but that should be homework. And explain, what to do when you leave school and you're not sure what you're going to do when you get home. And certainly within a classroom, it's interspersing low appeal activities, with things that, kids might have a higher interest for. Being animated and theatrical and dramatic, if that helps your students. And trying to schedule the most difficult subjects in the early periods of the day. Isn't always possible, but I know the school where I consulted, math and reading were always in the morning because we needed kids to be alert and, kind of ready to go. And you could have theater in the afternoon. Using daily or weekly school reports for good communication between parents and teachers. My little caveat was not to weaponize these, because often what can happen is that a report home becomes a report about all the things that aren't working and aren't going well, when in fact it's really supposed to be an interactive exchange in terms of, this child might have a challenge around this, and I'm wondering if we might be able to try these interventions. I was going to say, I think I'm almost out of time, but I wanted to talk a little bit about, teacher conversations with parents, using the parent-teacher relationship to your advantage, acknowledging that parents are always the experts on their kids, but enlisting, help from parents to understand their child, and presenting yourself, if you're a teacher, as a partner in the process of helping their child. Collecting very specific behavioral data, not just like, they don't pay attention, really specific about where, things seem to be going awry. Also expecting that parents might respond defensively to difficult information about their child because they are the expert on their kid, but also being aware that it's important kind of not to back down when delivering information about things that might be helpful. Just a tiny bit about what kinds of things can co-occur with ADHD. So many kids with ADHD struggle in school, with behavior and with learning. For many kids, addressing their behavioral challenges will bring about significant academic improvement. However, many students with ADHD also have, very specific deficits, in like reading or math or writing, and those kids are going to require specific academic interventions to be able to address those issues in addition to the ADHD. 30 to 60% of kids with ADHD also have at least one learning issue. Reading is generally the most common one. And it's recommended certainly that students who are diagnosed with ADHD and who are having academic difficulties have thorough, psychological or educational assessment. And often this can involve, neuropsychological assessment to fully diagnose and understand the basis for the particular learning challenges. So my takeaway thoughts. Successful treatment for ADHD is really like this complex network of care. So we need parents with home interventions, school with educational interventions, often primary care, pediatricians, a child psychiatrist, and then supportive therapeutic interventions. And that was super fast, but thank you so much, and we'll have a chance for questions.
Well, I'm not going to waste any time because we've got a lot to talk about. The main purpose for these Mind Behind the Minds presentations are to present you with some information, but then provide an opportunity for questions. So I'm just going to talk in general about adolescent development in children with autism with a particular eye on some of the implications of that for education. And like Dr. Dixon, I'm going to go relatively quickly, but hopefully it will just open the door to questions later on. So one of the things is we focus on preschool children and adults an awful lot in autism for some reason. The preschool children because we think that's a good time for intervention. Adults because we recognize there's a great need for continued care. But the school age period gets less attention. When we get the numbers of kids with autism, that comes from second grade children. But as we know now, the numbers of children who are moving into adolescence is about 60 to 80,000 per year in the United States. And worldwide, it's the same thing, many more adolescents. I mean, kids become adolescents. That's one of the takeaways from this part of the discussion is that adolescence is a period of a lot of change. It's a lot of change for anybody, a person affected by autism, a person affected by ADHD. One of the difficulties for parents and teachers and affected individuals is it's hard to tell what the change is about, if the change is causing some problems. Is it due to autism? Is it due to adolescence? In general, what we see in adolescence from age 5 to 20 is, our brains continue to develop. And so that period of time in adolescence is a very important time for intervention, for education, and children with autism respond. They change. They definitely improve throughout adolescence, but life can be a little bit complicated. Because one of the things that happens in adolescence is the way we perceive ourselves, in that we begin to perceive ourselves as objects of attention of other people. And in adolescence, that can create some issues. In autism, we used to think that didn't happen, that people with autism were so aloof that they didn't really realize that they were an object of attention of other people. But now we know that there's a significant change in sensitivity to people's attention that occurs for all children, including children with autism. And one of the issues, this is a double-edged sword, because this increased awareness can be really beneficial to improving social interactions, if not necessary for improving social interactions. But it can also increase the awareness of intent behind negative comments, teasing, and bullying. And so with the benefits, we have to be aware of the risks as well. And we have to be able to anticipate this in adolescence with people with autism, regardless of intellectual development. And we have to, when we anticipate problems, we need to talk to kids about it. We need to anticipate and talk to children about it. And one of the things that really tends to increase, not in all children, but in many children, regardless of whether they're affected by autism, but certainly the case in kids with autism, is that fear of negative evaluation goes up for these kids. 10, 15 years ago, when we were doing the research on this, we couldn't even convince people that this was a reasonable question, because people didn't think that people with autism had the wherewithal to fear negative evaluations, but they're just like everybody else. This really changes in adolescence, and you can really see a marked uptick in fear of negative evaluation. We also understand one of the basic features of autism is having difficulty coming to the same point of reference or having a common perspective with other people. We really use this in young children, diagnostically and intervention, but now we're getting data that shows that this continues to be an area of a different path of development for people affected by ASD. People with ASD can adopt a common perspective with other people. They do it all the time. It's simply more effortful because the brain systems that drive this are perhaps not as well connected. It's not, an impairment sounds like you can't do it. It's really more of it takes more time and effort to come to a consensual point of view with somebody else. When we think about attention, particularly in adolescence, one of the big questions is Attention is a problem for ASD, it's a problem for ADHD. What's the difference? Can't explain it, really. Won't try, but I can give you an example. If a group of kids are going out hiking and they have many different paths to walk down, they can decide to go down one path. What might happen then that would give you an illustration of attention in autism and ADHD is that most of the kids would start walking down the path, and the children with ADHD might get distracted, walk off the path, and then forget to come back on the path, because ADHD is both distractibility and sort of working memory, bringing them back to task. For kids with autism, they might not go along with the consensus. They might not start walking down that path at all. Both kids would end up lost off the path, but they'd end up lost for completely different reasons, both of which relate to attention, though. Very different aspects of attention. Now, this is really important to understand that metaphor with regard to kids with ASD. It helps you understand the struggles that they're going to have in school, that they're often not going to get the point of the assignment or even know what the point of reference of the assignment is. And this shows up in a variety of ways. One good example is in reading, where adolescents who can read, children with autism go on to read, many of them, most of them, but they still have problems with pronouns. And there's a classic adult study of people with autism in processing pronouns, and it takes them about 3 times longer to process the pronouns in text than it does for someone else. It's not that they can't process it, it takes longer. So it becomes more effortful to follow the consensual point of view or the points of reference while they're reading, and that makes reading more difficult. That's just one thing that makes reading more difficult. We'll come back to that in a second. A lot of reports on sleep and stress, particularly as children with autism get older. The data are a little bit mixed. This particular study says that, kids, adolescents with autism have more problems, but they didn't find a clear pattern of difference with other adolescents. And so that's a good thing to think about. Adolescents start to show a lot of variation in sleep. Kids with autism start to show a lot of variation in sleep, particularly in adolescence. We don't know whether this is an adolescent issue or an autism issue. But there are other studies that do suggest that kids with autism are probably more at risk for sleep disturbance, and particularly as they move into adolescence. That's very important to be aware of and to try to get services for if possible, and there are a variety of different treatment approaches. Because, as we all know, if we're very, very tired, like many of us are in this room, it's hard to follow what somebody else is saying. And if you already have difficulty with that, it makes it even worse. So we want to pay attention to that. We also want to understand anxiety. There are people here at the Mind Institute that are very interested in anxiety and autism. Anxiety, we all are familiar with anxiety, and anxiety can undermine our effectiveness in a lot of situations. The same thing for people with autism, but we don't necessarily think of anxiety or depression. We don't think of that being a risk for adolescents, that they can be comorbid for anxiety or depression or something else. But they certainly can, and in fact, there's some data, and I'm not going to go into this, but to say that their whole physiological response to stress is different, and that they don't have a lot of latitude to deal with stress, or as much latitude as other people do, and so they can be more stress responsive and more likely to have episodes of stress-related anxiety than perhaps other adolescents. But the good news is that people with autism respond to the same treatments for anxiety for the most part. I mean, there's medications might be a little bit different, but cognitive behavioral treatments can be very, very effective with children and adolescents with autism who have anxiety. So as a parent or a teacher, if you think anxiety is an issue, it's very important to try to pursue that and identify it if it's there, because effective treatments are available. Academic development in teens with ASD, it's something that we haven't been paying enough attention to, but most often, most adolescents with autism will have problems learning in the classroom. partly for the reason that I just said. They have a difficult time following what the consensual point of view is, or the point of reference is in a classroom. In the research that we've been doing here, we're looking at reading comprehension in 8 to 11-year-olds and 12 to 16-year-olds with autism, ADHD, and typical development. And we can see even in the youngest group, they have difficulties with reading comprehension. You see that beginning to emerge in the ADHD group. By the time that you're a teenager, it's even more evident because comprehension's so important. It's, as Dr. Dixon was saying, it's there in ADHD kids too, but it comes from different sources. So that's a very, very important thing to understand. There are individual differences in the path of reading development for children with autism. Some children with autism have dyslexia. They have problems with phonemes, phonemic awareness, and that leads to their comprehension disturbance. But another group of kids are very good at word attack, phonemic awareness. They can fool their teachers and they can fool their schools into thinking they're doing just fine in reading, and then they begin to crash at 4th grade when reading comprehension becomes more and more important. One of the interesting things is how well a child with autism reads is directly related to their symptom presentation. The higher the symptom presentation, the more likely they're going to have reading disturbance. So we've developed a center here. It's called the RAD Center, where we're trying to really understand that and develop interventions for reading. A lot of it is based on Emily Solari's work, who has developed interventions, and they are potentially quite effective. So one of the big things, I also worked with, I did research with young children, infants, but clinically I've always worked with adolescents and young adults. And so one of the questions that I always faced and never knew enough about was a parent coming to me and saying, my daughter's becoming, they seem to be becoming sexually active, not necessarily with other people, but I can see it emerging in their behavior. What should I do? How can I address this? Well, the best thing is to talk about it. And in particularly, this study, and you'll be able to pick this up, it's a marvelous study of how effective it can be to have a very structured protocol of talking about sexual behavior with children with ASD in allowing them to feel better about themselves and others, but also addressing some of the acting out or the inappropriate behaviors that may come up around that issue. The same thing with physical activity. Physical activity is always important, but especially important in adolescence. There's some very good studies out there now about the fact that, kids with autism are as active, they engage in as much physical activity as other kids, but they do it differently. And so you have to be aware of that. Team sports is not the place where most adolescents with autism would prefer to be engaged in physical activity. It's in hiking and in swimming and things of that nature. So now we have data that says, if you want to encourage your child with autism to be more physically active, you might think about trying to understand what the preferences might be and go with those preferences. And then finally, just to be very, very quick, one of the things that's an issue that parents talk about is that transition phase from school, secondary, into adulthood. And there's any number of topics we can talk about in question and answer. But one of the more important ones is talking, is having your medical team talk with you and your child about what's the next phase of medical support. Because as you move out of pediatrics, you have to then be able to move into adult services. And now there is a literature emerging that will guide parents, especially in this regard. Okay. Thank you very much.
All right, good evening. My name is TJ Vidales, and I am happy to be here. I'm so glad that we get to talk about what goes on in the classroom. I do wear many hats, but I am here to primarily represent the educators from a general education perspective with my personal and professional understanding about students with executive functioning challenges. Okay, so the first question that I would like for you to think about is, can my child do this adequately? I'm going to show you the next slide, and I want you to think about it as you see the next slide. So executive function, the ability to organize cognitive processes. This includes the ability to plan ahead, prioritize, stop and start activities, shift from one activity to another activity, and monitor one's own behavior. So how well do your children, or if you're a teacher or any kind of role model, how well does your children do these? Right? Gotta love them. Okay, so typical outcomes that's been observed in a general education classroom for students struggling with executive function. Assignments are not turned in on time. They appear to not know the due dates, have difficulty retaining information, especially when given orally. They tend to not ask questions about the lessons or directions. They often get anxious, frustrated when things don't go their way, or it's like, what, there's a quiz today? And then they blow up or they retreat within. And they have social difficulties with peers, especially around middle school, high school, when they start to become very much a little bit more socially aware, as Dr. Mundy had explained. So it could be outward, or it could be very suddenly turning inward. Okay, so if you could kind of think about Avery and Julian, this is not a very specific student, but if you could, for the sake of argument, kind of imagine Avery, who has minimal eye contact and kind of not sure from the teacher's perspective if they're paying attention or not, appears shy and quiet, tends to avoid conflict or communicating with teachers and their peers during class, and prefers a more quiet and structured classroom. Julian, on the other hand, tends to be more distractible, chatty, distracted, zoning out, doodling, taking apart pens, right? They love those springs, right? May appear defiant and argumentative or immature, tends to be impulsive, reactive, and may have difficulty sustaining focus, especially with uninteresting tasks. So kind of picture somebody like that. So what may be the cause of those outcomes? So for Avery, the interactive classroom may feel really overwhelming, and like trying to hold on to what information is being said is very difficult. And what I see a lot is that they may resort to doing something that makes sense to them right now, even though it's not exactly what I asked them to do. They're doing something because they know it's important, but they're off task technically. But they kind of want to stick to it because they know it's important to stick to it. Education is important. Avery tends to feel overwhelmed and anxious easily, and especially when communicating with authority figures, they really don't like to question teachers. They feel like they're questioning teachers if they're just asking a simple question, and they have a hard time differentiating that, so they tend to not ask questions. And they're typically, they're good students, right? And so they don't get into trouble typically. Julian loves the interactive classroom, but it's not really working out too well. It's too distracting. The noise may interfere with the processing and the working memory, especially appears if they're being defined or not listening on purpose. So that's one of the things that teachers tend to kind of sometimes may be reactive and think, oh, you're not listening to on purpose. No, I mean, yes, they are, preteens, teenagers, but it's coming from their challenges. Simple tasks may feel overwhelming, difficulties with breaking down the steps and priorities of tasks, and sense of time. It's like, what, 30 minutes passed already? Wow, I didn't know it was time to go. I'm trying to sharpen my pencil still, right? Has great intentions, and this is one thing that I really want a lot of the parents to take away. They really do have great intentions, that they really mean to. However, a lot of the times, Julian tends to fail, and it just kind of perpetuates, and because they're living in the moment. Okay, so what can we do to support our students more effectively? So we really want to encourage and coach our students to gain self-awareness by utilizing concrete strategies, assessing their progress, and gradually removing support as students demonstrate success. Now, easily said than done. I think a lot of us know this, right? And it's different for every single situation, child, family, culture, there's so much going on. And I think it's difficult, especially kids on the executive functioning umbrella, because it really has to be customized. One good question to always ask is, will this allow my child to become more self-aware? So if I remind my child about what he needs to do for homework, will this allow my child to be more self-aware? If I email my child's teachers to send work home with my child, will this allow my child to become more self-aware? Okay, so this is just a quick example of, you want to do this, which is like an open-ended question where the student or your child cannot say yes or no to. So, for example, what do you need to do for your homework today? Can you show me? It's not a yes or no. Versus, don't forget to do this today. Did you have homework today? Yes, no. Okay. What supplies do you need to complete your math project today? Versus, don't forget to use this, don't forget to use a ruler, here you go. So you really want to think about how can we help the students become more self-aware, is to really ask them, really hold them accountable as you're supporting them, versus appearing like you think like they can't do it. You know they can, but you really want to encourage them to think for themselves. So one of the strategies toward gaining self-awareness is that ask those the open-ended questions instead of telling or reminding. Specifically, I think Dr. Dixon had shared about having a parent conference, or maybe having a plan at the beginning of the school year. My suggestion would be to set up something within the first 2 weeks of school, hopefully before the first day of school, with a very student-driven and personalized 504 and IEP plans, or at a glance, that you make with your child, because us teachers, we are legally supposed to be getting a glance and 504 plans. But sometimes it doesn't get to us in time, sometimes it's very wordy, and it really does not help us really support the students right away. So if you can create something with your child, that'll be great. Another suggestion is to pick one day a week where your child checks in with his or her teachers. And on the same day, you and your child will check the grades online, for example. Sit down and say, okay, let's go over it. And your child is on the computer. Your child is clicking onto the sites, and you're there. And you're really kind of prompting the questions. It's like, oh, so you could see it as a parent. You may be getting the email, so you know maybe your child is getting an F right now, but you're gonna ask the child, it's like, okay, what are you getting in math today, math right now? Oh, you have a D. How is that a D? And ask questions. You may know it already, but really prompt the child to be involved. So there's a lot of topics, but strategies surrounding homework is what I'm going to focus on. Okay, when you're checking your grades online, and if there's anything missing, I would encourage the child to print it out, whether it's at home or at school, the school library, and use that as a checklist. Okay, have them highlight it, have them circle things. Oh, I don't know what that is. Okay, honey, what do you want to do tomorrow when you go see your teacher? What do you want to ask? If your child has questions, especially if they tend to forget, right? You're like, okay, make sure you ask your teacher about that project. They come home and like, oh, I forgot, right? So in order to avoid that, you can support them at home and for the child to write the email and have the child CC you and have the teacher reply all. So you're in the know, but you are not driving that car. Your child is in the driver's seat and taking responsibility for his or her own actions, okay? And I think this can be done even at elementary school level. You know, as sooner the better, I would say. Okay, other strategies surrounding homework, especially if your child has an IEP or 504, you really wanna be their coach and accurately identify what his or her strengths are and their challenges are. So if your child believes that, oh, I have an IEP or I have a 504 and it says note-taking, but I don't need that because I'm not gonna listen to it. So then that's not really gonna help all the trouble you went through to get the 504, the IEPs. We really want the students to own it. In order for that to happen, we want them to feel empowered with the information. So can the child say, can I be more successful if I had copies of notes so that I can focus more on listening? So we really want the children to be able to say these things to themselves instead of us telling them this is what you need and this is what you should do. And it's, again, is easier said than done. And it's really a lot of repetition and coaching and kind of guiding and framing the questions. Okay, strategies. One last one here. If they did not turn in their homework, I know it's really hard, but please do not scold, yell, or punish your child, okay? Instead, really take this opportunity to have a separate time that's kind of protected, where you really sit down and talk and say, okay, so why did you not turn in this homework? Because turning in homework could mean a lot of things. It's not just because they didn't want to, they didn't care. It could be that, did they even know there was even homework at all? They may have not known. You knew maybe, but the child didn't know. Did they know that it was even due yesterday, right? Or did they have all the materials? Oh, I knew it was due, but I didn't bring this home. Or they were too scared or too overwhelmed to ask the questions that they needed to complete the homework. Or maybe sometimes there were they didn't like the teacher. It's like, I'm not gonna do it because, she me off, right? Like, I don't like her, like, she really upsets me and I don't wanna do it. So there are so many things. So one of the things you really want to understand is, I think, Dr. Mundy's, slide about the kids getting lost, the outcome is the same, but why are they not turning in homework? So we really wanna put on the detective's hat and really try to understand what's going on with the kids and why they're missing out on certain things. Okay, gaining self-awareness is really, really critical. I know it's kind of a very general topic, but it will get you the buy-in that you really want from the kids, especially for those with the 504s and the IEPs. They will know, they will be able to advocate and say, this is what I need during the IEP 504 meetings versus you coming in and say, this is what my child needs. It's very powerful if a child says it and owes it. Self-advocacy, whether they have a 504 IEP or not, when they go off to college, they will be able to go to professors and say, this is what I need, will you be able to provide it? They will have confidence, and that tends to kind of, I see a lot of situations where they feel empowered, so they're less anxious. And that means if you know that note-taking is what you need. So for example, I tend to do better if I just listen. If I take notes at the same time, I don't do so well. If I know that, then I could proactively say to, let's say my professor, say, just letting you know I'm not being disrespectful when you say take notes, or to other professionals, I am listening, that's the way I work better that way. So you can be proactive, and your children could be more proactive and feel more empowered, and they will be less triggered for things that they may kind of lose control over or feel overwhelmed about, okay? There are, I know you can't copy those links, but if you talk to Ms. Terry Contenti, she said that she will be able to provide PowerPoint. There are several links there that has great forms that are downloadable as an example. For the IEP at a glance, or some behavior contracts, and some summary sheet that you can provide to the teachers. Okay, all right, very good. Thank you very much.
Okay, so here's the first question. Do you have any suggestions for resources or books on how to guide or help my daughter through puberty and how it affects ADHD?
Does this help? I think in Dr. Russ Barkley's book, Taking Charge of ADHD, there might be a small section that talks about that transition to adolescence. There's also a book by one of our collaborators, Dr. Stephen Henshaw, who is the chair of psychology at Berkeley, and he has done I think he's got a 16-year longitudinal study looking at teen girls, and he started when they were, I think, 10 or 11, and so they're now in their late 20s, early 30s, and I believe in his most recent book on ADHD, which you can get on Amazon, he there is some information about kind of that transition to adolescence and what might be helpful, because he really has looked specifically at a lot of the behavioral and emotional issues that are specific to teen girls with ADHD.
Okay, so here's a question. How do you handle a child who doesn't want help or strategies and hates being helped and sees it as being stupid? I guess I'll address that to TJ.
They say they don't want the help, but they truly do want the help. And I think that parent does know that. I think it's baby steps. I think the first thing I always tell the parents is that whatever the grade level, if they love school and they love going to school, they love the friends, they may not like the teacher, but they love going to school, don't really think about the grades. Really focus on that social emotional happiness and have them, you know, feel pride in something they'd love to do. I'm great at this, I'm great at that, but I'm not doing so well on this. And have them just really have that conversation and have them start to be more honest and own their challenges. And the conversation could be like, it's okay if you're not doing so well in this one, but which one do you think, you know, you could do well? So let's say if it's a middle schooler and they are having difficulty with just turning in homework on time. You're like, okay, for right now, maybe let's just focus on that. Let's let all the other ones go for right now. We will communicate with the teacher that we're gonna focus on turning in homework only for, let's say, the next month or something like that. And really have the conversation with the child, the one that he or she thinks, it's like, okay, I think this is something that I could do. It's close enough. So little steps. Because they really want to do well, so we don't want to give up on that, but we want to go student-driven and little by little success positives.
I was going to say, and I just wanted to add a piece to that, that it's really important to normalize the fact that we all have different brains, and, you know, some of us are good at this thing, some of us are good at that thing, and for many kids who are saying, I don't need help, it's because, you know, this is making me feel stupid. This is making me feel like I'm not capable. And sort of normalizing the fact that, you know, we are all not good at everything, and, you know, sort of getting them to like accept that, you know, yeah, let's think about the things that work for you, but then let's also begin to talk about the things that might be harder for you.
Here's another question on puberty. How do I make, my son's going through puberty. How do I make sure that his behavior at school is appropriate? So I guess it comes back down to communicating with teachers.
So being an 8th grade teacher, there's a lot of that going on. And a lot of the kids, you know, for boys, I see them just trying to act tough, but at the same time, your hand is in the, you know, literally in and just walking. You know, it's like, is that just trying to be cool, or is there something else going on? Or they would like hug, but they would just, with so much energy, and it's like, okay, you gotta back off. And a lot of times they don't know that energies may be coming from their, you know, development, you know, versus just being hyperactive or not knowing. So, you know, without putting too much spotlight on it, you just want to kind of let them know when, perhaps when they're calmer, it's like, I noticed you did this. What do you think about that? You know? It's like, oh, I don't know, it's okay. If they say it's okay, then you really do maybe have to have a further conversation. But if they're like, yeah, I know, it's kind of weird, but, so I think really kind of letting them know that you saw something that might not be appropriate, or the teacher shared that with you, but not in a very embarrassing way. Again, maybe you're driving somewhere a lot of the times, you know, difficult topics, like you're washing the dishes and maybe the child is right next to you, or you take a walk on the beach. This face-to-face is a worse situation. So like, hey, by the way, kind of nonchalantly bring it up.
I mean, I would add that it's very hard to ever talk to a child about almost anything, but certainly sexuality without concrete examples. And so I think TJ's saying, if you can see a concrete example, work from that example. If you're worried about it, there's probably a reason that you're worried about it, so maybe there's some concrete examples that you have not commented on. It's always okay to say, a couple days ago, this was going on, and I started to wonder about that and wondered about your feelings, and I just wanted to talk to you about it. Or, fortunately or unfortunately, you can use sitting down and watching a movie with a middle schooler and adolescent, if you're willing to sit through some movies that are pretty raucous, and then have that as a shared experience that you can then go back to. It's pretty hard to talk to a child in the middle of the movie because they're going to think you're just interrupting their video time. But if you've seen it, you can go back to it and talk about it, and that's the concrete nature of the conversation is pretty important.
Great, okay. So, Faye, can you talk about why the age of onset was raised from 7 to 12?
Yes, because ADHD has a number of different presentations, and the symptoms that are the most obvious, which is the hyperactivity, the restlessness, the fidgetiness, occur earlier. I mean, those are easily recognizable. But many kids present only with symptoms of inattention and distractibility, and those don't often get noticed until around 4th or 5th grade, 6th grade, when, these are kids who are not like sitting and wiggling and looking, like they're not, on task in school, but because of that inattention, they're having difficulty remembering assignments, remembering what they've just been asked to do. And so because we know that inattentive symptoms, particularly in girls, can emerge later, that was part of why the age of onset was raised. I mean, it used to be, if kids have ADHD, we have to see it by age 7, otherwise, it's something else. And now we know that we can see those symptoms later because of that inattentive piece.
So it encompasses both ages. It was not one trading.
Right, exactly. Yeah. No, it's just that we've moved up. Yeah, it used to be if these symptoms were not present by age 7, it's probably not ADHD. I mean, that's what I learned in the dark ages in graduate school.
So you're trying to catch those.
Right, exactly. We're trying to catch those kids who may only have that inattentive presentation, right? And that tends to emerge later. Yeah.
Okay, any advice on nurturing visual learning strategies?
So one of the issues there is there's a curriculum, and teachers may be guided by that and may or may not feel as though they can incorporate the visual strategies. And then I think you just have to talk to the teacher and sort of negotiate with them. And if they don't know anything about visual strategies, they can usually talk to the school psychologist or one of the specialists in the school to bring the visual strategies into the classroom for the child. So that's the short message, because you really have to get the teacher on your side, and they may either have the expertise or they can get it within the school and bring it in. But you can also work on that at home around homework and around other areas of learning to the advantage of the child, if that's really going to be effective for the child. And it doesn't hurt to do that as a parent, because you can quickly come to understand what is effective all the time, what is effective some of the time, and what is not effective at all. And it can surprise you in terms of, how those things change over time. Visual strategies can be working for a period of time, but then the child develops and it's no longer so effective. So it's actually good for parents to experience the implementation and what's effective so that they really know what's working for their child.
So I think that math in particular, for example, a lot of math teachers loved math, they were great at math, and they become math teachers, and they tend to be more linear. I personally struggled with math, so it's kind of a family joke that I'm teaching math now. But I'm a very visual person, and I need to have visual layout. I can't have it all messy. I make my own worksheets because I cannot have little tiny space to show work, right? And the font size, and I'm very picky about that because I understand how important it is to have a very visually clean or something that is going to be easier for the kids to follow. If the teachers are willing, it's definitely good to provide them examples that you would like for them to perhaps consider and model. If that doesn't happen at school, it will need to kind of be done at home. Maybe when you are going over the homework with or trying to kind of do the step-by-step, you would use some kind of a template. Understood.org has tons of great templates, and some of them that I had on my link are from the understood.org. For example, what I noticed is some students, if you remember a table, like a function table with the X and the Y, some tables are, vertical, some tables are horizontal. And some kids do much better with vertical, some better with horizontal. So if you could figure out that your child does better with vertical versus horizontal, that's one leg up to really help focus on the content versus visually getting kind of confused. So there's so many aspects to math especially that has to do with visual, pattern recognition. And so if you could figure it out with your child, simple things like that, circling with certain colors or drawing a line, right? If you could do that and the child knows that, then you could present that to the teacher and say, this is how we're doing at home, and this really works for my child. And that child could also say, yes, teacher, this works for me. Then the student could teach the teacher and how to be better helped and supported. So.
Okay, here's a question for TJ. When you ask open-ended questions to a child with executive function issues, and you know the response is wrong, for example, the due date, how should you respond?
If they genuinely say the wrong date, then said, okay, you let that failure happen. As if the child comes back and says, oh my gosh, it was actually due yesterday. It's like, oh, so let's see, where did we miss that? Was it teacher had it on the board, teacher said it, and you didn't write it down, or you saw it, but between yesterday and today, you forgot that it was the date that you saw yesterday. So it's really about going back and trying to be more reflective versus, why didn't you know it was this? It's not going to do anything. So the more you do this and say, okay, there's a pattern, for example. I'm noticing that whenever teacher says it, you're missing it. But when teacher writes it on the board, and maybe you're taking pictures of it, maybe you're doing better. So let's figure out what pattern, which way works for you, which is much more productive than actually letting them know that the due date is yesterday or today. So failures are wonderful, and we have to embrace that. And we don't want them to worry about failures when they're a junior or senior in high school. We want them to really fail and make mistakes when they're younger as soon as possible.
I was just going to add that for some kids, if they're receptive, you can say, let's check, so that we know for sure when it was. And for some kids, them checking and going, oh, it was today is more helpful than you saying, it was today. So some kids might be open to like, oh, well, let's check. Can you look it up? And,
So this is a sort of a question around strategies and resources related to a child with a recent diagnosis of ASD who's now needing to transition into junior high. How can we make this transition from elementary to junior high with absolutely no resources or training to assist? So maybe resources, either, I guess, parent resources, maybe some of those are in your list, TJ.
Right, so resources for maybe the parent and the child?
Right.
Am I getting it?
And maybe approaches and strategies for working with the new school.
Right, yeah, and so like school visit, when there are kids there, I think it's worth it to take a day, take a day off from the elementary school and to make a prior arrangement with the principal or anybody in the special education, if that's part of the resource, meet with a counselor that he may be, meeting, and have that connection, personal connection. Or sometimes maybe the counselor might say, let me give you a pass, a few of them in the beginning, so you could just use this. If you get anxious or you get worried, you could just use that and you could come see me. Have the child go to different classes and maybe possibly walk through some of the, again, with other kids there, maybe during passing periods, and to see how chaotic it could be. But having that actual experience without being really a junior high student yet, like it's that exposure in regards to just kind of getting used to things. Academically, do you know if the elementary schools and the junior highs are communicating effectively where they get that information right away from day one? Right. Right, so I think whatever information you have and documentation you have, as soon as they're open, they're typically open first week of August, right? I would say you go in there and especially with that, have an SST. It doesn't have to be an official 504 IEP meeting. You could just say, I really want to meet with his maybe reading teacher, resource teacher, and this is what I see at home, and have that prior communication.
You could also,
ask for
and you could also have your IEP for the following school year done before you make that transition. So that's part of the transition, is get your IEP done. Yeah.
So do you know which school? They haven't identified the school that he's transitioning to, or have they? Okay, great. That's a leg up right there. That's very important. So everything that TJ just said, but also it would be very useful if you take pictures of all the people you're meeting with. When he gets in there, take a picture, have, either he does it or you take pictures of teachers, and ultimately peers if possible. Keep those at home. This is a visual exercise that will help him manage the memory component of who's who, and you can actually talk to him about talking to people in a way that he's going to understand or have a little bit greater likelihood of understanding. The other thing is to prepare a passport for the child. So there isn't too much known on transitions, but the one thing that comes out of consensus groups and the little bit of research is that if you can, develop a one-page advisory about what you're fairly sure works for your son or might set him off and make it harder for him to learn in the classroom with his picture on it, and deliver that, maybe laminated to different people in the school, particularly the it's harder at the secondary level because they're going to shift around, but he'll probably have a homeroom teacher, and you might want to target the language arts person, given that, and that will be effective. The IEPs are hard. They may or may not give the information that's going to allow a teacher in the rapid pace of a secondary school to really individualize. So sometimes the passport, if done well, can help. And there's actually a project going on here that could help you understand that a little bit better. So, my name's Peter Mundy. If you email me, I'll try to connect you with them because they might be able to give you the template for the passports that they're testing in schools right now. Okay?
Is giftedness and ADHD related? I think that's the question.
Right. Not specifically. That is, being gifted doesn't predispose you to having ADHD, but it is not uncommon for those things to co-occur. And actually, in fact, the school where I consulted, there were a significant number of kids who happened to have ADHD and dyslexia and were also, quite gifted. They just happen to co-occur, but they are not specifically related. Like one doesn't predispose you to another. Like being gifted doesn't predispose you to having it. You mean in terms of the rates of ADHD? I would have to look that up specifically, but I believe I'm going out on a limb and say that they're not so different. However, anytime you have a behavior that is more atypical, it's not uncommon to have something atypical co-occurring with it. Because, like if you think of like a regular bell curve and everybody's kind of in the middle, that as you get further away from the middle, it's not uncommon if you have something else co-occurring that's also something that's away from the middle.
This is a question more about strategies for college students with ASD. Not quite sure. So the disabled student services seem to only offer extended time or alternate settings for tests, but no real protocol for professors to follow once a student has tried to advocate for himself. I don't know if
I
there's
was
any.
going to say, I actually happen to just, this is not my area of expertise, but I actually just happen to read something today at, it's the University of California at Santa Barbara actually has a curriculum to help students with autism be more successful in college. And I didn't have a chance to read it because I was actually looking up something else, but I was actually very excited to see that, so that I actually want to go back and read what are those strategies and what specifically, are they doing at UCSB to help students who have ASD be more successful in college.
And I think that ASD or ADHD, we're sort of talking about these executive function issues for kids, and self-determination is another issue, and the question was more about self-advocacy to the professor. And so self-advocacy is very, very important. And I think that, a parent, or usually there's counseling available that will try to move children towards, or students, young adults, towards self-advocacy in college. The issue is that you really have to talk to the student about self-advocating, but recognizing the response patterns that may come back from the professor. Because they're going to differ. And some are going to really welcome that and be incredibly supportive, and others are going to not be terribly negative when the student does that, but probably not make the effort to be supportive, because everybody has different attitudes in any classroom, including collegiate classrooms. So in trying to get the student to self-advocate, you have to inoculate them a little bit against failure, because it's not going to be with one professor that they're going to self-advocate. It's going to be with many in college. There's many opportunities to do that. And really, it's going to be the one or two successful cases that are really going to benefit the student. And if you can sort of decrease the likelihood that they'll try it once, get rebuffed, and never try it again, that's probably the big goal, is to try to get a student to do that even though it doesn't meet with success the first time, right?
And I would say to also work with the disabled student services, because I think if you can find an advocate to help with strategies that might be specific to particular professors or certain departments, it's also easier to find someone can help you with everybody.
Right. I think there's also a lot of students now presenting on YouTube and talking to each other about this issue from the point of view of ADHD students and students with ASD. And then there's also the utilization of handheld devices to help students get organized or stay organized in a college campus, which decreases their stress level. They feel more mastery, and then they're more likely to self-advocate or follow a self-deterministic course if you can decrease the sense of I'm not able to keep up, because that can be something that's beyond a professor's control to really address. You might need to actually address that issue to allow the student to do better in terms of self-advocacy.
And so to add on to that, so if the student tries to advocate and the professor is receptive, great. And if they're not, then they could try the disability center and have those counselors or advocates talk to the professor. If that doesn't work, then you really want to probably coach your child and just kind of talk out loud and say, you did this, you did that. It is what it is. What are we going to do about it, right? Because when you go out into the real world, you're going to have bosses that are going to be very compassionate. Some are not. It is what it is. So is it horrible that you're going to pass with a C? If you had this support of maybe note-taking, you might get an A, but you're going to pass with a C. Is that so horrible? It's not that bad. You know you're capable if you had the note-taking support. You didn't get it. Hopefully they get the support, but I think it's that reality of let's just talk out loud and just know that sometimes life is just messy and we cannot get so stuck or so bent out of shape and be feeling overwhelmed where you cannot go back to school anymore. I'm just going to give up. I feel just too overwhelmed.
Okay, so I have one more question, and it's 7 o'clock. How to help think about locating resources for cognitive behavioral therapy for children with ADHD and anxiety if you live in a small town. It's not just if you live in a small town. If you live in Sacramento or lots of places.
I was going to say, my email is on the website, and I actually have some cards here, and I could give you the names of people because I am always desperately on the hunt out there for good psychologists and therapists who are working with kids exactly on these issues. So I have some cards. You can email me, or you can just go on the website and find my email.
And sometimes it involves working with your behavioral health for your insurance and
Yes.
who's covered, so
Right.
that limits it.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.